We do get a lot of calls for people that from people that are scared of the concept of a traditional facelift. They might say, I just want to address my neck. That may be possible, but it might not be the right decision. So, really it depends on the type of laxity, where it occurs, age range. Really, we spend a lot of time evaluating somebody's kind of the whole picture, because a natural outcome really means that things work seamlessly together.
An offering that we have for a patient who typically tends to be on the younger side, but they have isolated bulkiness and fullness in the neck without having jowl laxity and mid-face laxity, is a midline neck lift.
In our experience, traditional liposuction alone typically is not sufficient. Usually it's a multi-level treatment that's required to create real sharpness here.
Involves contouring of deep neck structure and tightening of the platysma muscle in order to create that sharp 90-degree angle.
I do think some people who are candidates for midline neck lifts or isolated neck treatments, they may have really early or mild concerns about other areas of aging, and we might introduce things like radio frequency treatment, like face tight, neck tight. Maybe someone would benefit from a little bit of upper facial volume with some type of fat transfer. Maybe there's some roundness or prominence of the buccal fat pads. And so, there are combination treatments that aren't traditional face and neck lifts. Somebody does present with notable laxity of this kind of continuous structure, then that's when we start talking more about kind of our standard lift, which is basically a deep plane face and neck lift.
The best candidate for a facelift or a neck lift, usually it's someone who has started to notice that there is less definition and separation between the jawline and the neckline, so that they kind of become one uniform piece of anatomy, and it's not two distinct structures anymore.
Typically what people see is kind of a descent or dropping of the soft tissues of the cheek and the jawline. People call this jowling. And then also a laxity in the neck. The soft tissue structure begins to descend. The bottom of the face starts to look more squared off, a little less heart-shaped, and you start to lose definition of the jawline, both from the facial laxity and the neck laxity.
When we think about the face and the neck, we really think of them as two contiguous structures that are very intimately related. Most of the facelifts that we do incorporate work in the neck. There's three kind of areas that are addressed: the neck, the jowl or the jawline, which is the same, in our minds, kind of the similar area, and then the mid-face area. Mainly because if you were to, for example, tighten the neckline and have this really sharp defined neck, you may still have the jowl spilling over the jawline. The type of facelift that we perform in our practice is a deep plane facelift, also known as an extended deep plane facelift and neck lift. And those can be daunting words for some patients. It's important to understand that in order to achieve a natural result, there needs to be release of tissues that have aged over time in order for them to be resuspended in a natural position. Those structures happen to lie in a deep plane. There's a lot of thought put into the way, the vector, the direction of how that deep layer is suspended. This is what gives you a long-lasting natural result, because the tension is put on that deep layer, and then once that layer comes up, the skin's going to come up like a passive passenger, and there's no tension placed on the skin.
A lot of people are interested in a mini lift. A lot of issues with mini lifts, and this isn't for all, but issues we see when we deal with revision face and neck lifts, is that mini lifts often focus on skin removal, and most of the tension or movement is based on skin movement. When that happens, you have A, tension externally, so things look tight or windswept, and B, it puts a lot of tension on the closure and on the incision, and that's how you get widened or unsightly scars. So when we're revising lifts that have happened with that kind of issue, we focus on moving that deeper tissue, taking all of the tension off the skin, getting rid of the laxity that bothers people. But because you aren't using the skin as a lifting structure, the outside surface should look relaxed. And that's one of the main components of a natural outcome. Mini lift can mean anything. It doesn't actually describe a particular surgery. Typically, incisions for a mini lift are the same as the incisions we use, which are standard lift incisions in the shadows of the ear.
So in reality, a deep plane facelift is what we believe gives you a long-lasting result, a much more natural result, and allows you to address the root cause of what's aging in the face. Now, if that's approached through the smallest incision possible, which is what we try to achieve, then you've got yourself a robust face and neck lift.
You can call it whatever you want. We are never going to compromise on doing what we think is the right procedure for you. All we're trying to do is make decisions that are going to lead to the best outcomes, so the best relationships with our patients, and our patients are our best marketing material.